talk about the differences between heparin and warfarin. So when it comes to heparin, the mechanism of action of heparin, it affects the intrinsic pathway by inactivation of thrombin and factor 10A, but warfarin affects the extrinsic pathway. As we all know, it inhibits the gamma carboxylation of vitamin K dependent clotting factors 2, 7, 9 and 10, which are involved in the extrinsic pathway. So warfarin is an oral anticoagulant, as we all know, but heparin is an intravenous or subcutaneous anticoagulant. So heparin has a rapid onset of action, and it has a brief duration of action, but warfarin, it has a slow onset of action and prolonged duration of action. And because of that, when you start warfarin, you have to give a loading dose of warfarin for the first few days and then start the patient on a maintenance dose. And heparin has a renal excretion mainly, especially the low molecular weight heparin. Therefore, the patients who are affected with end stage kidney disease, you might be reluctant to start low molecular weight heparin. But warfarin, it mainly it has a hepatic metabolism which is cytochrome P450 dependent. So when the patient is started on heparin, we should monitor the therapeutic efficacy using APTT, and warfarin is monitored by PT and INR. And when there's an overdose of heparin in a patient, you use protamine sulfate as an antidote. And when there's warfarin overdose, you use vitamin K as an antidote. And heparin doesn't cross the placenta, and it can be used while breastfeeding too, but warfarin crosses the placenta and teratogenic. Therefore, warfarin, if the patient, mainly if a pregnant mother consumes warfarin in the first 3 months, they get the fetus may get something called the fetal warfarin syndrome. Thank you.